had the worst day of my life, and it will never ever be the same. It all started on a cold, rainy October morning. I just moved to Michigan from Oregon, and only on the job for 2 weeks.
Did you hear that Oregon has something called the Death with Dignity Act? Yeah, it lets a person with terminal illness who has less than 6 months to live administer a lethal dose of drugs to themselves for the purpose of ending their life. I know, it's great.
Mrs. Smith, your results are in. You have incurable aggressive brain cancer and you only have 1 month to live without treatment. The treatment is long and severe and has many side effects, and it may not work at all.
I'm not sure about this treatment. What are the
So we will begin your treatment immediately. The nurse will be in shortly to give you your first dose of the medication soon.
Doctor, I have a couple more questions. Hey sis.
Hi.
Oh my god, I got some terrible news.
No.
The doctors have diagnosed me with brain cancer. They give me 1 month to live. There's one treatment, but the side effects...
Holy Mary, Mother of Joseph! You have to do the treatment. You have to live. You're my sister. I'm gonna go get the doctor.
No, I don't want this treatment.
Doctor!
Hi, Mrs. Smith. I'm graduate nurse McMorkian. I'll be taking care of you while you're in the hospital. I'm going to make sure that you're comfortable and you're able to get all your affairs in order. But I'm afraid I don't know much about your treatment or your diagnosis.
I'm not doing the treatment.
You're not doing the treatment?
No,
Are you sure?
I'm not doing this treatment. I'm old and I want to die with dignity. I'm in pain. I'm suffering. My husband had this treatment and he died a horrible, agonizing death, and I do not want to be like that. No, I don't want it to end like this.
Are you sure you don't want to do the treatment?
I'm sure. I do not want to live like this.
If you don't want to do
I'm
the
in
treatment,
so much pain.
there's an alternative. It's being done back home in Oregon for patients with terminal illnesses. It's called assisted suicide.
Yes, that's exactly what I want to do. Just don't tell my sister, she'll kill me. I want it to be quick and painless. Can we just do it after lunch? I ordered tuna casserole and cheesecake.
Doctor, you have to do the treatment and save my sister's life. She's the only person I have left, and I know she wants the treatment, but she's just scared and overwhelmed. Please help her.
All right, I'll talk to the nurse and get her started on the medication right away.
Oh, God bless you. Thank you so much.
That nurse better hurry up. Nurse Betty, finally. Jeez. I have the orders for the medication in the paper chart. That stupid computer keeps freezing on me. The medications are ready for you to administer unless you feel like you can't do it.
Okay, doctor. Graduate nurse Morky and I will take care of it.
Get started.
What a jerk. Of course I can do it. I'm part of this team too. That stupid doctor wrote the medication order for the wrong one. I'll just take out the right meds and I'll let you do it.
Okay, well, I talked to Mrs. Smith, and she understands the medication, but she only has one request to take it after lunch.
Okay. You can give it at 1300 then. Make sure you check the 5 rights beforehand.
Okay, I will. Right patient, right drug, right dose, right route, and right time. Your medication, Mrs. Smith. Are you ready to take it right now?
Yes, I'm ready right now. I want to get it in before my sister comes back from the cafeteria. She just doesn't want the same treatment that I do for myself.
Well, I have to hook it up to your IV port, but you're going to have to inject the medication right all by yourself.
Okay.
Do you have any questions?
No, I don't. I'm ready now. I can't wait to see my husband again. Oh, thank you, dear. All right.
Okay, when you're ready, just push the plunger, okay?
Okay. All right. Thank you so much for your help. Now, do you mind if you just leave me alone to my thoughts?
Hey, Anna, have you tried the tuna casserole? I heard it's to die for. Anna? Anna? Help! Somebody help!
Get the gun out of here!
If only I had communicated properly with Nurse Betty or the doctor about the patient's wishes, they would have informed me about Michigan's laws regarding assisted suicide. If only I would have checked the electronic medication administration records and be up to date on current treatments and interventions, I wouldn't be in this horrible situation. If only I would have collaborated properly with my coworkers, asked questions, and practiced legal patient-centered care, then I wouldn't be here. If only I would have practiced proper end-of-life care, such as using proper decision-making about end-of-life, information exchange, discussion, and treatment options, and making or not making decisions with the patient. I should have discussed the end-of-life issues correctly, concretely, openly, and sensitively, and created an environment to help communication and facilitated interactions between Mrs. Smith, her family, and the doctors. Not only did I lose my license, but Nurse Betty and Dr. Hurt did too. If only I would have been a better nurse. If only.
Darn that Nurse McMorkian!
The tuna casserole smells even better here than it did at the hospital.
Take 4.
That was bad.
Hi! There's also
Treatment, but the side effects are...
Holy Mary, Mother.
covered in cord.
Jennifer.
I need all that.
Jennifer.
And action. Dr. Hurt is now Dr. Love. You having fun?